your job is to empower patients.
Right.
To what?
Well, a educated consumer is the best customer, generally speaking. Same thing is true in healthcare. Anything we can do to help patients understand their illness, understand the things about healthcare that they need to, that makes better utilization of the system and empowers people to utilize the interactions with their healthcare providers in a better way.
Let's break that down a little
Sure.
bit. An example would be?
Well, if you have diabetes, for example, and you know more about your disease, the basics, you know, what it is, what you have to do to take care of it, what to eat, medications, etc. When you talk to your doctor, that's going to be a different level of conversation than if you're still trying to figure out what is diabetes. It's a totally different level of interaction and really helps us get to the point where we can help you better take care of your disease.
But Chris, how does the average person get access to that information so that they can be this so-called educated consumer of healthcare? I mean, how do they do that?
Yeah, it's difficult, Steve. There's a lot of information out there. The internet
Some of it's confusing.
It is.
And contradictory.
Right, exactly. Right. So what we try to do is provide a single source of information that's reliable, that people can go to, whether it's on the internet, whether it's through our health coaching programs, our disease management programs, our
What's
care
health
management.
coaching mean?
Health coaching is where a nurse reaches out telephonically to a patient to help them understand their disease, helps them work through their issues, helps explain what the doctors have prescribed or what the doctors have said. So it helps physicians in the sense that we're sort of the extra eyes and ears and hands for the doctor's office.
How much has being a healthcare consumer changed just in the last 10 to 15 years?
It's changed a lot. I mean, it went from the golden age of the doctor knows best and you know, sort of blind following, if you will, to now I think people are getting more educated and more empowered. Hopefully it's with the right information, which is what we're trying to do. And really you know, driving that conversation a little bit more. I remember when I was in private practice, people would come in with stacks of printout from the internet on what they think is wrong with them, of all the research they've done. And the first thing I would have to do is spend the first 10 minutes, you know, weeding through that and saying why they don't have X, Y, and Z before I could get to what they really do have.